Gibb. Thanks for being with me today. And today I want to talk about CBC, which is a complete blood count. And you might just look at your labs and say, oh yeah, everything's okay, but specifically there's more to it than that. So I wanted to break down this a little bit more specifically today. So hang in there. It's not real complicated, but there are a little bit of technical terms in here. So your white blood cell count is what's in the part of the CBC. And your white blood cells, actually, there's two groups of white blood cells, granulocytes and agranulocytes. So the granulocytes, basically, they are considered neutrophils, eosinophils, and basophils. And they're just a form of the white blood cell. And the reason why they're called granulocytes, they actually have granules in the cytoplasm or the cell fluid. And so that's why they're called granulocytes. They also have a nucleus that's multilobar, so it's like almost like a bunch of little grapes together. The agranulocytes, they actually are not in the cytoplasm, and well, there's no granules in the cytoplasm, and they actually contain monocytes and lymphocytes, other forms of white blood cells. So lymphocytes are present when there's a virus. Monocytes are like the Pac-Man that go and clean things up. And so the nuclei are not lobular, so they're not more than one. And so white blood cells have a lifespan of 13 to 20 days, so they regenerate. All these are made in the bone marrow, so you have to always, they recycle and your body produces more of them. And if you look at, it's called the differential, which is part of the CBC. And whenever I look at the differential, I always say, that you should have the neutrophils actually should be about 50% of the total when you look at percents. The lymphocytes should be about 30% of the total as an average. The monocytes about 10%. The eosinophils, like usually less than 3% or so, and basophils should be 1 or under. So when you look at this whole system of how your body is, your immune system is what the differential is as to what's going on. So typically, if you have, if a child has gotten mumps, measles, rubella, etc., and chickenpox, even as an immunization, then their white blood cell count can go up, and then eventually it will go back down to normal. Your white count will be greatly elevated if you have a leukemia. And the lymphocytes specifically are very high. And then the differential, the technician will say possibly there's some smudge cells present. And smudge cells specifically helps denote the practitioner that it might be a chronic lymphocytic leukemia. If you have an acute viral infection, there's called a sedimentation rate. That usually goes up. The lymphocytes, which are an acute viral issue, they go up. The neutrophils are usually normal. And sometimes the bands, which are early, immature white blood cells, go up with an acute infection, such as mono. And then the last part is acute bacterial infection. An acute bacterial infection, your white blood cells can go up. With a chronic bacterial infection, kind of like a chronic viral infection, many times your white blood cells will drop. If somebody is eating very cleanly with a plant-based diet, I commonly see the white blood cells under, 3.5, 3, something like that. And so it just, you just have to look, there's more to it than just looking at the numbers. When the raw foods diet is eaten, you always have to ask somebody about their diet, especially if their white blood cell count is down. If it's chronically down, typically you may want to go see to help differentiate there and make sure there's nothing else more concerning going on, and possibly going to a hematologist to get that evaluated. If you have any questions, I'd love to help you on your journey to good health. Just give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.